A $45 an hour assistant.
Oh,
Do you think
Lord.
it's do you think it's possible?
I mean, I know that different states, um, they have different caps, I guess, on a dental assistant job position. I really hate that our cap is so low in a lot of states. You know what I mean? Because I feel like assistants can do a lot of things, and as an assistant, you have to learn what you can do within the scope of your like job in your state. Every state is different. Every state has different rules on what you can do as an assistant. Like some states, they will allow you to place a composite filling, but
Mm-hmm.
in North Carolina, um, we can't do that. So we have to do what's in the within the scope of our job, and I feel like that does hold assistants back on making as much money as they could. But yeah, I always get asked. It's funny because when I get like the things that I do, we get to do a lot in our office as dental assistant, and that includes placing purple permaflow, which is like an orifice barrier at the end if we're doing like a temporary filling. And I'll get into the doctor chair and I'll get the microscope. Like I know how to look through the microscope, and I know how to work through the microscope. And the patient's always like, oh, are you some type of like like are you a doctor as well, like what's your job position, like because we do so much there, and it kind of makes you feel good because you're like, okay, like this is I'm not just an assistant, like
Right.
I'm doing a lot
Yeah.
more than just what an assistant would do. So
Yeah.
but we don't have anything like in North Carolina, we don't have expanded functions dental assistant. There are some states that have that, but we don't have that here because we can't do composites or anything like that.